So we're really talking, not like the minister was talking about a revolution, because in February he says, I'm going to create a revolution in this province, and we're going to change the way people practice in all, he wasn't just talking about pharmacy, but all practice, to focus on the patient, putting the patient first and giving patients choice. I'm telling you that it's not a revolution for pharmacy. We know these things. We've got the infrastructure to be able to do this. So I see this as an evolution. We're going to change our focus on different sorts of things so that we can evolve, we can bring the profession along, we can coach and mentor people to be able to make a real difference and reflect the needs that's expressed by the minister, the needs that society needs, is talking about for a sustainable healthcare system. And so we call this moving the mountain because there's a little bell curve, as most of you know from university. And we are seeing when we're out there and we're hearing from the public that while a lot of pharmacists are practicing to meet the full standards of practice, there's a significant number of people who aren't doing all the things that are required of in the standards of practice to be met. So if you want to look at the quality of care and the number of prescribers out there, this isn't something that I'm drawing numbers to, but generally the graph looks like this, that probably where the peak of that graph is where we say the regulations are. In other words, don't do these sorts of things rather than this is the minimum that you should be doing. So what we want to be able to do is move that graph more to the right so that more and more of the public is experiencing practice that's meeting the standards of practice. Enhancing health outcomes by increasing adherence to those standards and to the code of ethics. And it does go back to our mandate. Now, some people think this is just with the police force, but every healthcare professional has this duty to serve the public and to protect the public. And this is the mandate of the college. We're there and we look at those roles that we have. Many ways, though, we've been seen as the organization that is focused on that protect. So if you do some harm, we're going to step in. If you can prevent the harm from occurring, we articulate those things in legislation. And so that's been our focus, but should have been our focus. Maybe we need to also, we're not going to lose that completely, but maybe we should focus on that to serve part. Help our registrants understand that they have this duty to help, to benefit, to improve by making a proactive difference. What good is it if you get the right drug and it's exactly right, if you're going to do that as according to the prescription, but it wasn't the most appropriate medication for you? Should we be involved in those sorts of things? And if that's our role in the future, then we need to get this concept of we need to serve by that benefit, improve, proactive difference, and then we need to articulate those things in the standards of practice and the code of ethics. So those two things, it doesn't mean that there's only one, but we're not going to focus only on that protect. We're also going to focus on that serve part of it as well. So it's asking practitioners who are out there to focus on that patient and their health outcomes and doing the things that add value to the patient, because you're going to have to do a risk analysis. Just like a physician, just like a nurse practitioner, you can't do everything. You do an analysis and find out what's the best. And we need to be recognized by patients and the other members of the healthcare team for the value that we're bringing to that system. And that value isn't just the volume of prescriptions, but it's the appropriateness of the prescriptions that you're on, including should those be, some of them be discontinued. And if we're going to move forward, we need to make sure we have the skills and ability to be able to do those sorts of things too. At the college, our focus is going to be on the standards of practice, the code of ethics that I've been talking about. Last year, I gave a talk about the professional responsibilities, how we're not just responsible for the task at hand, but understanding what's happening before and afterwards. And we're going to be held accountable for those sorts of things too. And the things that make the most difference for that patient and for public safety generally. So we're going to be looking at systems, not just events, and looking for ways that we can coach and mentor you to be able to improve your systems as well. So in this light, we're introducing a new practice assessment. So it's in a pilot phase, but how many here have experienced our new inspection process over this last year? Anybody? A few people, right? And I think if you may agree with me that it's significantly different than it used to be. It's really focusing on those things that we're expecting of pharmacists in the practice towards making a real benefit for the patient. And then we're trying to coach and mentor people to be able to do that. Do we have it perfect right now? No. What we're gaining experience and we're learning from it. And every time we go out, we're bringing people back on a periodic basis and changing it to make a real difference so that it works for you and it's also working for the patients. So that's a new practice assessment. It's focused on coaching and mentoring. We've changed even the name of our people who go out from inspectors, and we're doing an inspection. Instead of an inspection, we're doing an assessment. And from inspectors to community practice advisors. And there'll be practice advisors on the hospital side as well. So those things are happening. We've done over this last year extensive training of our staff to be able to do this. And they've learned about skill sets, about coaching and mentoring, how to figure out we're an adult, not like kids anymore, but well, how does an adult learn? What do they need to know? What can they relate to? And then figure out how we can help motivate them, but also understand what the responsibilities are. And we're moving away from an operational checklist to focus on procedures and practices that have the most impact on patient care. And then we're developing a whole lot of resources. So some of the things that you may notice is we have a YouTube channel with a lot of videos on it. And we're partnering with the University of Toronto for some sessions to be able to be delivered, including very difficult things of how do you deal with a physician who is upset because you adapted a prescription. And that gives some really good techniques for you to be able to deal with that person.